name's Betty. I oversee the rollout and implementation of some of our new features. The most prevalent right now, I think, which is insurance claims data. And this is part of our newest Radar service. Most of you are probably familiar with Expert Radar. Expert Radar was just rolled out in November. It's exclusively available through Expert IQ, and insurance claims is the newest and most exciting addition to that. So what we'll be doing during today's call is, number one, I'll give you an overview of what the term insurance claims actually means, what insights you can gauge from it, and how this might be helpful for your practice and for preparation for your upcoming depositions or trials. And then I'll show you what the data itself looks like in Expert IQ, which is your online portal account. While I have you all, I did have a couple more updates. Litigation Analytics is also a brand new addition to Expert Radar as well, which is an analysis of an expert's litigation activity. So some really helpful charts and graphs for you to break down an expert's litigation, especially if they're a bit more prolific. But just as a 1,000-foot overview or level, Expert Radar, as I mentioned, was rolled out in November, and in its simplest form, it's a vast collection of information on experts. And all of you, I think, on this webinar call have access to this service. It's very much included in your firm's contract with us, and it can be used both on opposing experts as well as your retained experts. The way that this service is delivered is the most important part of it. It's delivered through Expert IQ as opposed to a stagnant PDF, meaning that every time you log on to your portal, if you requested Expert Radar on a couple of your opposing experts, it's always consistently updating and detecting new changes. So let's say, for example, your opposing expert just had something come up in their criminal background check, or they published something new, or they switched jobs. The profile changes and you get an email notification, like a digest email. You know, what's new with your experts this week? And Expert Radar is extremely comprehensive because we do gather information both from an automation standpoint and scraping our various sources and databases, as well as an actual internal team who's making sure that, you know, if your expert is John Jones, that this is in fact your expert as opposed to someone entirely different. There's a good bit of information in Expert Radar that's really tough to get anywhere else. But I think the most notable is this newest feature, which is insurance claims data. So this will be a tab on Expert Radar that's going to be released on April 5th. So very shortly, you'll be able to see it if you already have an Expert Radar that's been ordered on an expert or is already ready to go. And simply put, insurance claims data is a very insightful look into an expert's practice. So for medical experts specifically, you'll be able to see how often, to what degree they're submitting claims through insurance companies for procedures and diagnoses. And we're able to capture about 75% of the what we call claims market. So both through Medicare and about 75% of commercial insurance companies. So it is very accurate insight into an expert's practice, and it's also very detailed. And I'll show you again how you can see this data, but you can see this information for any type of medical expert, not just necessarily a physician, but anyone who has an NPI number or a national provider identifier associated with them. So that could be a doctor, obviously. It could also be a psychologist, various types of nurses, dentists, physical therapists will all have this data available for them at no extra charge. So it doesn't constitute an additional fee. Now, why would this data be important? Well, for a number of reasons. I think the first is that besides just what you can see on an expert CV, this gives you really exclusive data into an actual expert's practice. What are they doing every single day? What are the types of patients that they're working with? How much can they really say that they're an expert in a specific area? Another reason is that commercial insurance claims are tough to get anywhere else. And Expert Institute has been working behind the scenes for years to be able to provide this to you folks. So it's something that is not easy to come by, to put it simply. And lastly, the way that we present this information, and like I said, I'll show you an example, is put in the context of an expert's peers. So for example, you have an opposing orthopedic surgeon. The data doesn't necessarily say, well, this expert does, I don't know, 50 arthroscopic knee replacements in a year. That would only be so helpful because you'd look at that and think to yourself, is that a lot? Is that a little? What's everyone else doing? So instead, we provide you with a percentile. So you'd be able to see, based on all the other, 10,000 orthopedic surgeons in the country, this expert falls in the 20th percentile. So it's very much contextualized based off of all of the other experts' peers in that particular specialty. So what I'm going to do, without further ado, is just show you exactly what this data looks like. It's a little bit overwhelming at first, but I'll show you all how you can break down the various types of data and where this information will live. So I'm going to jump into an example, and I'll move into our online portal. This will be our demo site, but this is an actual expert who we've put together this profile on. This is an expert radar on Dr. Call. Now, I would say that there are two distinct insights that you can generate from this data, and I'll show you both. The first being just the number of surgeries or diagnoses that they're seeing in relation to their peers, as well as the trends of that, if they're going up or down, let's say. So if you log on to Expert IQ, on the left-hand side, under Expert Radar, you'll be able to see every radar we've put together for your retained or opposing experts. And for your medical experts, there's always the professional tab, litigation activity tab, and risk and credibility tab. Since I last logged on, there's 2 additional items that we've added. And for your medical experts, there will be a 4th tab that's called insurance claims. Now, the first thing that you see is a bit of a disclaimer. I mentioned that insurance claims captures about 75% of the claims market. So this isn't necessarily an end-all, be-all to the types of patients that a physician or medical expert is seeing, because some people could be paying out of pocket, for example, or using an insurance that might not be part of the participating data that we're providing. But it is a very accurate picture and gives you an idea of the angles to find or how to potentially direct your line of questioning in a deposition or a trial. If I give this a quick scroll, Dr. Call is an example of a really excellent expert, which might not otherwise be immediately obvious in his CV. Right, so just giving this a quick scroll, and I'll give this a second to load. You can see that the data is broken down into a couple different ways. The first way is you'll be able to see that I can separate it into commercial and Medicare claims. We are sourcing this from 2 different sources, so you'll be able to see how many claims he's submitting through commercial means, as well as Medicare, and as well as the period. So the data goes back to 2019. So if I wanted to see specifically how much he's performing certain surgeries or giving out certain diagnoses from the period of 2020 to 2021, maybe that was a date of incident of my case, I could filter it down to that. As well as his specialty, if he has multiple specialties, which this expert is certified in both bariatric and general surgery, I could also look from those 2 different lenses. And finally, the region, national versus this expert state, which is New York. And typically, the percentiles will be similar across both of those ranges, but it could be eye-opening to see that, maybe this expert is in one of the top percentiles in the state of Alabama, but not necessarily nationally speaking. And I can also see that there are 355 other bariatric surgeons in his field who I'm comparing this data against. His procedure volume and diagnosis volume gives you just a very quick glance into how active is he as an expert compared to others in his field. And I can immediately see that it's pretty excellent, right? So he's in the 96th percentile for procedures. So he's very active as a surgeon. as well as diagnosis. So just the variability of the types of patients that he's seeing is in the 89th percentile. And I can also see how that's trending. It's trending upwards just a little bit for procedures and downwards a little bit for diagnosis between the period of 2020 and 2021. So I did mention that it could be eye-opening to see if his practice is trending upwards or downwards in any way. So I'll explain a little bit more how that can be used, especially against some of the other information we have available for him. Scrolling further, this will break down each individual claim that he's submitting based on the claim code or CPT. The CPT stands for Current Procedural Technology. So essentially how each one of these procedures or diagnoses is classified according to how the insurance will be billed. I could search by keywords. So if I wanted to search up, a keyword that's very relevant to my case, I could do that. And I can also see, scrolling over to the right, a visual cue of the percentile and the trends for each one of those individual procedures. And I could also switch to diagnoses if I wanted to see specifically more the types of patients he's working with as opposed to the surgeries themselves. So again, this is an example of an expert who is very highly qualified, very active. I'll also show you an example of an expert who is maybe not quite as excellent as Dr. Call. So I'll switch over and show you an expert named Dr. Spar, who's a neurologist. Now, just to compare and contrast, if I navigate to insurance claims, to get a quick look, he's more in the 45th or 41st percentile for procedures and diagnoses. And this is really helpful to see, especially if you anticipated that you were up against a really excellent expert. Maybe on paper he looks great. Dr. Spar is in fact highly well published, and he's also presented quite a bit at conferences and is quite active in his community. However, the data supports that he's not necessarily top in his field in terms of the work that he's actually doing day in and day out and working with patients. So if you're looking at this in terms of the numbers themselves, so how many patients does he work with a year who have spinal stenosis? Let's say your case hinges on spinal stenosis. You have someone who suffered from a delayed treatment with spinal stenosis, and Dr. Spar is your opposing expert. I could take a look and scroll down further to his insurance claims and specifically search up stenosis. I want to see how often is he working with patients with stenosis, right? And in giving this a quick look, there are various ways that this is billed. And I can see that he's moderate in terms of working with patients who have lumbar stenosis. But if I give this data a little bit of a more detailed eye, I can also see that he works with patients with spinal stenosis of the cervical region not at all in the past year. Between 2020 and 2021, he submitted 0 claims for patients with spinal stenosis of the cervical region, whereas 6,815 other neurologists across the country did. So it's not necessarily that this is rare, it's just that Dr. Spar doesn't really work with those types of patients. So using this data, I could say, well, when I'm about to cross-examine Dr. Spar, I'll bring that up and I'll ask him, how often do you work with patients who have spinal stenosis? And maybe Dr. Spar answers, oh, well, quite a bit. But using this data, I could further press him and say, well, how often do you work with patients who have spinal stenosis of the cervical region versus lumbar? Because that's what the case hinges upon. Your client has cervical spinal stenosis. And Dr. Spar could say, well, actually not quite as much. And you could say, well, isn't it true that cervical spinal stenosis is much more severe than lumbar, and the treatment outcomes can differ significantly? Well, yes, that is in fact true. And all of a sudden, you have a much more detailed way of pressing the expert and directing your line of questioning versus if you didn't have this data at all and might not have known to ask that question about cervical versus lumbar spinal stenosis. So that, I think, is a really powerful way to have this data as background knowledge that you already know and knowing how to press an expert a little bit further. Maybe if Dr. Call, the expert I showed earlier, is your retained expert, it's a good opportunity to let him know, hey, you're really an active expert, and that's something that you should be emphasizing more and more if the opposing side brings it up, with just how many of these types of patients you work with. So it's just extremely powerful background knowledge to go in with, because you understand the expert's practice maybe even a bit better than they do. All right. So the other thing I wanted to touch on is I mentioned that there are two different insights you can gauge. One being what I just showed, which is the numbers themselves for specific diagnoses or procedures. The second being the trends, right? So whether or not over the past year, Dr. Call has started doing more procedures or less, and that number has stayed very consistent. But it could be indicative of whether or not an expert is winding down their practice. So maybe across, 30 years, the expert has done quite a lot of procedures, but in the last 2 years or so, it's dropped off significantly. That could be an indicator that the expert is winding down their practice, starting to pick up more and more expert witness work, and maybe even headed for retirement, which is tough to know if you're, again, just looking at their CV. That's not necessarily a good indicator of whether or not they might be winding down their practice, whereas these trends right here could definitely be an indicator, and again, something to bring up. So insurance claims, I think, are very powerful to look at alongside an expert's litigation activity, right? So under this expert's profile, litigation activity is another one of these tabs. So I could cross-reference and see that maybe while this expert is submitting fewer claims for procedures or diagnoses, maybe concurrently their expert witness litigation activity is going up through those years. So Litigation Analytics is another brand new update that we've just placed in Expert Radar. If you all haven't seen them yet, it's right here under the Litigation Activity tab. And it's very nice for experts who might be, we'll say, more prolific, because you can quickly see, how often are they testifying for the plaintiff versus the defense, for what areas of law, and activity over time, which, again, could play in very nicely to the procedures and diagnoses and their insurance claims and where that's trending over the past few years. So these are two things to be on the lookout for. The next time you log on to Expert IQ, navigate to Expert Radar, and if you have a couple of experts who are already ready to go, you'll see that litigation activity has a brand new analytics section that breaks down the actual cases themselves really nicely. And you'll also see for medical experts this new insurance claims tab